Thanks everyone for joining us today on our webinar where we're going to look a bit forward. We're obviously fortunate to be involved with a sort of a webinar with the PPMA a couple of weeks ago where we looked sort of looking back in terms of the current crisis we're all in and some of the challenges that that's thrown up and how we and how a couple of our customers have dealt with those challenges. What we're looking today at is kind of taking some of those lessons learned and also looking forward to some of the challenges that we might face in the new normal, whatever that looks like. So we've got a panel of some expert sort of speakers here. So if I just go through the panel, first of all, to say thank you to everyone on the panel for taking the time out to go through this with us. On the panel today, we've got Karen Grave, who is the PPMA president. So the PPMA, for those who on the call who are unaware, is a body that represents public sector, HR and OD. So Karen's will be joining us on the panel from that perspective, but Karen's got a wealth of experience within sort of the HR and OD profession as well. We've got Harpreet Darku Braish, who is the Head of Procurement and Delivery Assurance from Matrix Managed Marketplace. So Matrix Managed Marketplace is a sister company of ours who operate a neutral vendors sort of model for professional services dealing with projects and statement of works and sort of that side of things. Previous to working at Matrix Managed Marketplace, Harpreet also worked with the Environment Agency, Department for Education, and Bloom. We've got Ian Middleton, who is the Business Director for Matrix SEM for the Midlands and the North and everywhere else in the country, and seems to be spread far and wide. We've got an ongoing joke that he's trying to go as far southwest as possible so he can spend more time in his caravan down in Devon. And then we've got Vanessa Carthy from Lancashire County Council and Natalie Ludlow from Worcestershire County Council. We were due to have Phil Leach from St Helens Council, but unfortunately Phil had a bit of an emergency within the council that popped up, so he's sent his apologies today. So just sort of topics we're looking to cover, as I say, is sort of some practical challenges we might face around social distancing, some workforce challenges, how we can start to return to business as usual, social care, what some challenges around that might look like, some of the traditional challenges that you all probably face around summer peaks and annual leave and how that might be affected by what's happened over the last 3 or 4 months with people maybe not taking annual leave and things like that, and just dealing with just the general aftermath of what we've had. If anyone on the call wants to ask any specific questions of the panel, if I can just ask everyone just to use the chat function, and then we'll try and pick up those questions at the end of the call as well. So without further ado, I'll start whittering on and get on with the questions. So the first question really, if I sort of start and pick on one or two, but what steps can HR put in place when looking at the returning workforce, when considering issues around social distancing and alike and a new norm? Karen, have you got any views on that?
So thanks for the question, Chris, and thanks for the invite to the panel. I think there's a number of things around this. I mean, I think that, the first thing is that obviously Public Health England have been defining some really fantastic material and guidance around social distancing, but the reality is, I think as HR and OD professionals, we've got to be really pragmatic about it. So the first example I've got, which is quite interesting, is that you can't actually social distance effectively if you're a refuse collector. So 2 meters actually is wider than the width of a refuse van, which is 1.87 meters. So there's some really interesting practical challenges that we've got, and I think this is where we've got to use our mouse, but the reality is that effective social distancing is a combination of a number of other things, which will include PPE, which will include thinking about how you design your workforce, your workspaces. So in an office environment, you can do things like spreading out desks and stopping the whole hot desking approach. But I think the reality is that we've got to be pragmatic, and our context has got to be king on all of this.
Absolutely. And some of the challenges, like you say, is stuff that we're going to have to really think about. I mean, I was speaking to a HR person from another council yesterday, talking about sort of just practicalities of things like using lifts and things like that. How are you even going to get to the 5th floor if you're all in a lift sort of thing? So
exactly. Chris, one of the things, to be honest, that I'm actually personally quite surprised about is that we haven't seen the degree of industrial scale cleaning that we have in the Asian countries. Now, I know there was some talk around that in terms of, do we do that with the tube and other transport systems, but certainly some organisations, it's been done in retail already, is they're stopping their offices being open at a particular time so that they can clean overnight. So I think these are some of the things that we're also going to need to take into account. But the reality is that certainly most of the people most of our membership community, they're not talking about bringing anywhere near the volume of the workforce back into the office until at least September. So I think that will give us, time to pilot some approaches to see how effective they are.
Absolutely. Anyone else from the panel got anything else to say about that particular subject?
Chris, just a quick question for me, and I'm just wondering if any of the authorities that are on have got sort of any indication about how they're going to be bringing the workforce back into the buildings, so that more of the office-based staff, and sort of what's the approach at the moment for a sort of a phased approach of bringing staff back into the office environment?
So I'm happy just to pick on this initially, and then obviously please others join. So the initial approach, Ian, has been to bring back people who may well be at home not working because they physically can't do their jobs. Now, actually, the vast majority of local authorities have been able to overcome that. So the truth is we don't have very many people sitting at home doing nothing. But most local authorities and other public service organisations have still had people in their buildings because they can't do their work from home. So where that has been the case, then you can socially distance. It's much easier. You can do the 2 meters. You can separate people across floors and what have you. You can make sure that there's, the antiseptic barriers and all of the rest of it. You can do that. The key priority actually is frontline workers and looking at when they need to be in the office. There's a particular concern around social workers, so whether they can do face-to-face or whether they can do it virtually. There's a view in the community that they've got they must do their work face-to-face. But the reality will be, as far as possible, and as far as we're hearing at the moment, that everybody who can still work at home will continue to work at home over summer. We'll start to introduce some teams coming in right the way across the workforces to be in the office, but that is likely to be an exception rather than the rule. So very much a mixed economy in terms of working from home and being in the office, just until people get a handle on it and until people feel confident about doing it. Biggest issue at the moment has been schools, as you might expect, and figuring out how we can support that.
Yeah. Natalie, I know obviously Worcestershire have been looking at stuff around schools and things. Have you got anything to sort of add in terms of some of the things that Worcestershire might be doing? Natalie, are you still there? Oh, I think we might have lost Natalie there for a second. Kathy, sort of Vanessa, sort of have you got anything that sort of Lancashire have been doing? Can you guys hear me? Can anyone hear me? Vanessa, can you hear me? Vanessa?
Hi, are we having difficulties with audio? I'm just catching like the last kind of few words every now and then. So can everybody hear me? Or I did catch some of that conversation. Okay, I can come in now if you want me to share what language you're doing. Okay.
Absolutely.
So in terms of Lancashire, initially what we did is that virtually everybody went home, and those who could work from home did work from home, and those who can work home from are continuing to work from home. But obviously, we're massively residential social care in terms of our older people's and children's social care. So we don't seem to have had the major issues in terms of PPE in the counties. So obviously we can't social distance in older people's care homes when we're caring for people. For other places like our refuge centres that we do use Matrix for, we have opened the refuge centres, obviously with social distancing, so you have to make appointments to be able to go and drop off refuge and things. For existing staff, I've been into County Hall just recently this week, and they've started putting up signs in terms of social distancing about how we use the stairwells, how we use the lifts, things like that. But I think what we're probably going to be looking at is staggered starts. So where people who are going into the office, we don't have everybody coming in at the same time. We are using more things like Skype and Zoom and Teams a lot more. So I think we're just going to have to get used to a different way of working. For our agency workers, and I'm not sure whether we're talking about agency workers on this call, but in terms of the high volume, we have agency workers who are working at home, who we've provided equipment with to be able to work from their own broadband at home. So we're not seeing a kind of massive impact in terms of people not being able to carry out their jobs. But on the other side, we've had nearly 4,000 people deployed into other roles as well. So in terms of like our excess death teams and people actually managing COVID, so coming out of their role and going into other roles, the strategy now is that we're standing those teams down, is that how we then introduce them back into their old roles, their existing roles, and how we make that happen. So we are moving in terms of a strategy out of COVID now. There are various lessons learned and teams that have been set up. So we're now looking at our transport and how we move people around the county. So there's specific teams who are looking at that, who are COVID teams who are now working on exit strategy. So we are trying to get back to business as usual.
That's really interesting, Vanessa. In terms of those workers, those sort of people have been redeployed. What's your view on how they'll be moving forward in terms of, because obviously there's been a lot of focus, a lot of energy around sort of trying to deal with COVID and trying to be redeployed into roles that maybe they're not been particularly familiar with. Do you feel that there might be a risk of sort of fatigue for workers in general, that they might, if they go back to their normal day-to-day role? Have you sort of given any thought in terms of how those workers might be transitioned back into their existing roles?
Okay, so some of them have been deployed, desperate to get back into their roles. Yeah. Some of the roles that they've been doing have been quite grim, to be real about it. They want to get back to business as usual. They're still, as in local authorities, we're there to support citizens that are still there and need our support, even more so now, I suppose. We're keen to get places like libraries who are central hubs up and running so people can observe social distancing. But our libraries aren't just about books, they provide other services as well to citizens. So we're keen to get those services running. There are, in terms of, I don't think it's going to be an issue in terms of people being undertaking their roles. It's just doing it differently. So obviously people are worried about coming into a huge building like County Hall, where there's thousands of people working out of that building, and how they're going to be protected in terms of social distancing. We're already starting to put things in place. We're working with our public health teams, our health and wellbeing teams. We've got loads of information out about our intranet to keep people updated about what's happening. So whilst they're at home and feeling potentially isolated, and some people haven't been doing anything for 8 weeks, it's more about their, I suppose, well-being and their mental health as well, about them being prepared about coming back into work. So there is a job for people to do. It's just how we're supporting them as an organisation to be able to do that. And some people will start back more fast than others.
Yeah.
For example, when this all happened, we were coming up to end of financial year, so that had a massive impact for our financial people. So they had to then be able to work from home and pick all the systems up from home. Now we've demonstrated that we can do that. I suppose there's a lot of questions being asked about why haven't we done this before. So in terms of we've reacted to kind of an issue now, and there's nothing to say that this isn't going to peak again in the summer, or God forbid autumn, winter. And if it does, there's obviously issues there in terms of the NHS and the colds and flus that impact the elderly anyway, and impact our older people's residential homes. So we're preparing for people coming back. We're also still preparing for the worst that could happen as well. And everybody's keen to come back, but obviously there's a concern about how people come back and what's the expectation for them in terms of their new way of working, which people are adapting to.
Absolutely. Thanks for that. Really, that was really useful, Vanessa. Natalie, I know we lost you for a second. Are you back now?
Can you hear me now?
Yes, absolutely.
Hey. Yeah, we're pretty much in the same boat as pretty much what Vanessa said. We've been redeploying staff. We've initiated a Here to Help campaign where we've asked people if they've had previous care experience to complete an online form, and we're reassessing and redeploying people to work in our care homes. So we've kind of seen a bit of a peak in DBS checks going through for those staff members. But yeah, pretty much definitely support everything Vanessa's just said. And in terms of the building, we're just trying to work out, as Karen was saying, how that's physically going to work.
Yeah.
We've got quite an old building, if I'm honest, and we were thinking, even things such as going to the toilet, they're not 2 meters apart. You're going to have to shut cubicles. I mean, it's going to be a minefield. Currently looking at one way in and one way out of the building. So even if staff do need to use the toilet facilities, they're going to have to go all the way out of the building to come back in. So yeah, lots to consider.
It is a minefield, isn't it? And Ian, what do you think, if anything, what can Matrix or the wider sort of agency staffing sort of community do to support keeping employees safe?
I think as well, I think it's just keeping our dialogue open with the HR teams, which I think we have been doing. We don't really want to come into many surprises sort of further down the line. And I think I think these sort of sessions and also the teams functions have been able to keep the dialogue open, with the HR teams, and making sure that we are there to support sort of straight away if need be, and also maybe sharing ideas that we've had from other authorities, and sort of sharing that knowledge to make sure that we are fully on top of things for all of our clients.
Absolutely. Vanessa, I can see you've got your hand up. I think you're on mute, Vanessa.
Yeah, it was just really to add to Natalie's conversation, really, is that similarly to the NHS campaign asking for volunteers coming forward, Lancashire did the same as well to our adult social care directors on the Northwest network, and what we created was what they called the LTSA, which is the Lancashire Temporary Staffing Agency, that was working alongside Matrix to complement Matrix. So what we've had is that we've actually employed people on temporary contracts, so some with experience in social care, some not with experience in social care. and train them up to work in older people's residential homes with a view to supporting our external providers. So Lancashire, and like other councils, are responsible for provider failure. So if private care homes suffered any difficulties, go into crisis, then we as a local authority have to support them. We have to support them. So we'd created this agency similar to the NHS advert that went out. We've had some success with it. What we're finding is that the providers out there aren't necessarily in crisis at the moment or have needed the help of the Lancashire Temporary Staffing Agency. What's happened to kind of my kind of relief really is that the agency workers have stepped in because they have the experience. So the agency workers have been kind of running the homes, I suppose, with the temporary staffing agency people coming in and doing more of the kind of cleaning, kitchen, activity roles rather than the personal care roles that have that need for the experience, I suppose. So I just wanted to share kind of what Natalie was saying, is that obviously we've been looking at local authorities about other ways to resource our teams up.
Absolutely. Excellent. Thanks, Vanessa. That's really useful. Karen?
Yeah, so just some other observations adding on to what everybody has said. So Vanessa, there's also been different parts of the community nationally who've been doing very similar things. So Greater Manchester, interesting enough, obviously they've got devolution in the truest sense of the word across health and social care. So they've been working on an MOU, which basically means that actually anybody could work across all of those parts of public service. So you cut out sort of some of the internal nonsense about the bureaucracy in terms of who employs you, who doesn't employ you. Another great example of where there's been really effective working across CCGs, the voluntary and community sector, and also the local authorities down in Somerset. So the two Somerset acutes have really struggled in terms of capacity. So we've actually had the local authority down there take the lead on effectively commandeering 2 hotels, 2 other buildings, to basically create residential care environments, and that's actually been really extraordinary. I think one of the byproducts to this awful situation, and I'm with Vanessa, I think there's going to be another peak in autumn winter, and that's sort of my own internal anxiety. But what redeployment has done is it has forced organisations to take strategic workforce planning seriously. So I think, across the piece, we have seen an incredible amount of redeployment go on across the community. And we found, skills and experience and knowledge and wisdom in our existing workforces that we perhaps weren't using terribly effectively beforehand. So I think there's all sorts of really interesting things that we've learned. And Ian, to your point about sort of the dialogue, I think that workforce planning is probably going to mean that we are in a better situation to forecast what is going to happen if as the local resilience forums are working on, if we do get hit with a wave 2 over the winter months, because that's the stuff that's keeping everybody awake at night now. So I think that that is really interesting. And the other thing I would say is that for a lot of us who are opening now, and a lot of us who are taking our time, part of that learning is going to be, how do we shut down quickly again if we have to, and how do we open up again quickly? Because I think the first time we go back is always going to be tough, and there's lots of lessons there, but potentially the second and third time we have to do a lockdown and open up again, that's potentially where some of the mental health issues and some of the physical issues will come back to bear. So this, I keep saying to everybody, we are just at the end of the beginning on this one, and I think that context is really important.
Thanks, Karen. That's really useful. Vanessa, have you still got? So is your hand up by accident on? Okay, good, excellent. No, that's really useful. And I think some of the workforce planning stuff actually brings us on to some a really nice point around, well, not a nice point, but some of the issues that may be yet to come out. To your point, Karen, around we're at the end of the beginning. Some of the issues that you see in the media, that I certainly hear on the adverts with the NSPCC and things like that, is potential future peaks in social care cases, and as a result of being in this lockdown situation where people may be vulnerable in vulnerable situations. So be that children who might need sort of additional peaks. So around social care and what does that mean for workforce, but also around other issues and vulnerable issues around domestic violence and things like that. So I guess first of all, Ian, what's your view on the social care sort of market, and how are we going to come out of this, and how do we support our customers to deal with any sort of future peaks in an already stretched sort of environment?
I think we've been surprised with maybe how well we've done with the numbers during the period. So I think we've maintained, especially qualified social care, I think we've sort of maintained numbers. And CV submissions have been really good, especially on children's qualified. I think the agencies have maintained a good work ethic from home, which has led to us, I don't think we've had any dips in supply. I think also as well, we've had obviously a massive uplift in unqualified social care during this period, and some sort of unprecedented numbers to certain clients. And I think also we've also been drawn into certain Nightingale projects as well, where fortunately we haven't had to provide the numbers. And that was always our aim, to be there to support the client, but we didn't really want to place anybody, but have that sort of infrastructure in place should the numbers that we're talking about arise. I think sort of, especially now as we go into post-COVID, we do envisage seeing an uplift. I would imagine gaining an unqualified social care and potentially into adults qualified as well. So I think it's about making sure that we've got the knowledge from the client about what their sort of capacity is going to be during the next few months, looking at that sort of demand management piece individually as a client, and then making sure that we have got the supply chain in place that's able to cope and provide the numbers that are required by each individual client. Yeah. So obviously that's the piece now that we're picking up to say, you know, not a forecast of such, but how do you see this ramping up sort of post-COVID, and will there be any necessity for us to assist with things like track and trace and things like that, just to make sure that we are fully prepared and the supply chain is ready for those numbers?
Yeah. So how do we do that then, Ian? Is it more engagement with suppliers? What do we do?
Yeah, so I think it's both. I think one, we need to obviously understand from the clients what the capacity is going to be. It's then working with supplier engagement teams at Matrix to ensure that we have the relevant supply chain in place to be able to support that. It's working with, again, with the suppliers like we did for the Nightingale projects to say, what is your current capacity in these areas? Yeah. And do you feel that you have the numbers in place should we reach the numbers the clients are talking about? If we think there's any shortfall, it's then again just extending the supply chain and making sure that we've got additional suppliers in place.
Excellent. Karen, I can see you've got your hand up.
I think this is a really interesting one. I agree with everything that Ian has said. I have a suspicion, and it's a suspicion only, that if we do have a wave 2 over winter pressures, then we might need to start to see the more regional type of consolidation and working together on this. So certainly Care for London has done the same. You know, each individual borough is still putting their own advertising out, but actually realising that sometimes there's a power in the collective. And certainly from talking to colleagues in healthcare, that's a real challenge for staffing Nightingale, because actually, you know, the reality of it is it's absolutely incredible that through the help of our medical staff that we haven't actually needed to deploy into the Nightingales, but actually we can't be under any illusions. One of the reasons why the Nightingales haven't been used is that there haven't actually been enough staff to take them out of the hospital centres to actually put them in Nightingale. So I think we've got a number of things that we're going to have to work through in terms of thinking about what is the most effective way to staff people. So is it a Greater Manchester model? Is there a way of accessing supply chains that are slightly different or potentially need to be different if we hit a harder demand downstream? And I think that's where, you know, I know we've got a point about health and wellbeing. That's where looking after our guys who've been really going full tilt since the get-go. We really need to make sure they're okay if and when we get to the really serious rounds again. And the reality is our frontline workers have been on the front line every single day, and they haven't had a break. So managing that element of the supply, I think, is really tricky. So just my observation.
Yeah. Kathy, Vanessa, sorry, I keep saying I keep going to call you Kathy, Vanessa, because my eyesight's one, terrible, and two, it says Kathy, Vanessa, so apologies. But Vanessa, I can see you've got your hand up.
Yeah, I was just wanting to just to share that obviously we're talking about preparing in case the worst happens in a few months' time and there is a surge. We've definitely learned some lessons in terms of working on I've never worked so closely on Matrix like I have in the last 8 weeks. I'm the overall manager of Matrix. I'm not a user of Matrix. I don't procure workers from the system, but I manage the overall contract. And now that's slightly changed, and I've become a lot more closer with the supply chain. So we did a few things in the beginning, working with Jay and Lindsay, who were great in terms of advising us. So what we did was we do have some pressure points in the county. So there are certain areas, for instance, Barnoldswick in Lancashire, that is a million miles from anywhere else, very closed, small community. We did have a horrible experience a few bank holidays where the majority of our staff were off sick, self-isolating, and had to rely on agency and the LTSA. Very quickly, in terms of the Matrix supplier engagement team, engaged with more agencies to be able to supply into that home. So we did that, but there's some work to do on that yet. I need to give you a list of areas really, which are kind of hot homes, we're calling them, in terms of where we could do with increasing the supply. But then we also offered longer placements. So we what we call over-established in our homes, which cost us more, because what we do effectively is that we put more staff in that we need, agency staff, so that when staff do go off sick, we can rely on that agency supply. So we offered longer placements, and what that's supported with as well, because we still are really worried about cross-infection, where workers are being shared outside of LCC with other care homes, and how that's impacting on those workers then coming into LCC. So we're monitoring that quite closely in terms of what workers are coming every week and where they're going, and whether there are regular workers who are working across different homes, and then obviously stopping that. So longer placements and that firmer commitment to agencies has helped in the period of COVID, because we have some loyalty there. So we're offering the same workers the same homes to work in, and that's something that we're going to have to do going forward as well.
That's really interesting, and like you say, I think that might be something a bit of a lesson to learn if there is a peak in children's, for example, moving forward. That might be a lesson to learn moving forward for other local authorities, that potentially could be something to take forward. Karen, I can see you've got your hand up, and Karen, I know obviously you've got PPMA have done a bit of research around. I mentioned in the question around domestic violence. I know PPMA have done a lot of work around that as well.
Yeah, that's the domestic violence stuff is a bit troubling. I'll come on to that in a minute, but just to follow up on what Vanessa said about the longer placements, which just is a really smart thing to do for all sorts of reasons. But we've had a number of local authorities who've just taken the decision straight away that they were going to pay their agency staff. So, and this isn't necessarily agency staff working in frontline roles, but they were going to pay them what they normally pay them anyway. They would honour their contracts. We've even seen that done with casual workers, because that is all about securing engagement and long-term loyalty and what have you. So we've seen some absolutely incredible stuff done. Just on the domestic violence, Chris, you're absolutely right. We did a major national response on the legislation that is still going through Parliament at the moment, and we are aware. So we know that there have been deaths, and there've been a shocking number of deaths due to domestic violence across all settings since COVID has happened, and the calls have gone up to the various lines right the way through the crisis. And I think it's something that, as we talk about, what we think about returning to work or this new normal, I don't think we can say that this is a new normal. I think this is a new now. So we can't just sort of blindly go into that everybody will work remotely, because actually for a large part of our workforce, working at home is not a safe experience for them for a range of reasons. And we've been experiencing ourselves amongst our immediate community, people who we thought were doing well, really, really struggling. So it's a lesson, isn't it, about, oddly enough, through working through this crisis, we have had to become much more aware of people's home circumstances. And sometimes you stand back from that because you say, I don't want to intrude too much, but actually we've found ourselves being much more aware and much more open of people's personal circumstances. And I hope the good in that, the good intention will continue over the next months and years.
Thanks, Karen. That's really useful. Natalie, from Worcestershire's perspective, is there anything that you guys are looking at in terms of the future, in terms of future workforce pressures that might come up as a result of COVID?
Yeah, so we've kind of done the same as everyone else has said. We've mass extended all our placements till the end of the summer with the help from Matrix to take that pressure off managers. What we've got in Worcestershire is we have a relief bank. So I don't know if others have that, but we have a relief bank of staff that are our first point of call. So we tend to go to them first to offer up shifts, and then if they're unable to fill them for whatever reason, we then go to our agency pool. So we've been quite lucky up until now that we've had relief pool workers that are quite happy to work, and our regular Matrix workers that we have got have been coming on board as well and continuing to do their shifts. So from our point of view, it's, as you're all saying, it's now basically making sure that the staff that are on the front line and working their little bottoms off are going to get that rest before the next peak. So we're asking managers to kind of start looking at that now, because we did allow staff to carry over annual leave that they weren't able to take when this hit. So it's just making sure that they're rostering now and make sure they've got enough agency staff, relief pool, and their own, full-time staff in, and they're working on rotas to allow staff to get that break.
I think that's really important, and I think actually there's a question that came from Croydon who are in attendance, and it was a sort of follow-up question is around it's probably reflected in sort of your experience there, Natalie, in terms of there certainly seems to be some low-skilled roles, so whether that's refuge workers or, and I don't mean low-skilled in a disparaging term, but sort of adult, so unqualified care, there seems to have been enough people there to be able to meet the demand, and whether that's because of furlough and because there's more people widely available because of furlough and other businesses sectors sort of having a bit of a tough time, whether that's sort of helped in a strange way sort of local government sectors. Do you think as the wider economy gets back to sort of a new normal, do you think that might put further pressures on local government in terms of, in the same way as I guess when we bounced back from the recession in 2012, when and planners suddenly became a bit of a more demand in the private sector for planners, put a pressure on the public sector sort of in that regard? Do you think that might have the same sort of pressure for those low skilled workers who maybe at the moment it feels like there's a bit of a saturation in the market for those type of people, that maybe in 4 weeks, 6 weeks time that those people might not be there, they might go back to their BAU life?
Yeah, I think that's a good point. I mean, just talking from Worcestershire's perspective, we really thought and expected our agency workers, in terms of, let's say, care assistants, to peak and go mad. We haven't seen that, to be honest. Whether that is because our relief pool are, doing all they can to help. We've also, like I said, we've had that Here to Help campaign. We had over 1,000 people reply to offer assistance and previous experience. So we've been quite lucky. Going on to the point that Vanessa said, we've also got a couple of our care homes are out in the sticks, and it's whether people are going to want to travel. Are they still going to be nervous about travelling? Are they going to want to continue to work where they currently know and they feel safe? Or are we really going to see that demand when people, like you say, when furlong closes as such, are we then going to see a demand that we need more care assistance?
Yeah.
Swings and roundabouts for us, but we've been quite lucky up until now that we've not experienced it, and we're still recruiting.
Yeah.
So we've been very lucky.
And that's good. That's very good. Karen, I can see you've got your hand up.
So, Chris, just an observation. I think I certainly know that Worcestershire situation is experienced in other parts of the world, but then like Lancashire, where that there are other pockets of the country where the demand is absolutely incredibly high. Something that I just think we need to think about is, as ever, and rightly so, we focus on what we currently know are typically the hard to fill roles and where the really heavy demand is. One of the things that I think we can say for sure moving forward is that the pool of our population that local authority in particular supports from a community level is actually going to grow. So if you think about the number of people who are in, really in financial distress, so we know that the revenue and benefits teams are going to be massively busy because not everybody can pay. DWP have been completely overwhelmed. So there's just something for me about we've absolutely got to focus on what we know now in terms of our demand and making sure we can manage that through safely. But it's also just as possible for people who've been redeploying through relief banks and what have you, as they go back to their sort of normal roles, and as we start to ramp up service delivery again, we might find ourselves pretty quickly in a problem elsewhere. So a holistic view is something that we've always got to have at the back of our mind, really.
No, definitely, and I think that's from our side, from Matrix perspective. I think that's something that Ian and Julian and the wider sort of business management team will have to do and keep an eye on, sort of moving forward, to kind of work quite closely with customers to sort of manage those peaks and demands. A question for Harpreet. Obviously, Harpreet, I know you've been patiently waiting in the background. Obviously, from your perspective, how have you seen what's changed from COVID-19 in terms of the delivery of projects, and how do you think this will affect us when we transition back to the new norm? What's your experience there?
Okay, thanks, Chris, for the question. I think, like others have touched upon, technology has played a huge part. We haven't actually seen a lot of projects be paused or indeed cancelled, so it's meant that suppliers have just been able to continue delivering outcomes for clients, but using Zoom, Teams, Google Hangouts and all the rest to kind of carry on delivering projects and being involved in meetings and making sure decisions are still being made so they can press on with work. So I think technology has been really helpful, and I think actually going forward it'll be really interesting to see how much of that kind of continues, because from the supplier point of view we've had some great feedback, and from the client perspective as well, we're sort of pushing things on. It's meant like an increased flexibility in terms of delivery, reduction in costs as well, potentially, because suppliers aren't travelling to client site as often as they potentially were, and then that travel time they're using to actually deliver the work, as opposed to obviously commuting or whatever it might be. I guess there will always be an element of face-to-face interaction required to build client relationships, to understand our clients and the outcomes they're looking for, but technology has certainly helped, particularly in the kind of the social care space. We've seen some of our suppliers use technology to carry out low to medium risk assessments as well, which means that they've been able to get through assessments effectively, but also provide them with frontline staff a bit more of a work-life balance, because they're not, again, travelling between different sites potentially. So I think technology has been key. And then I think the other element which has changed how projects are delivered is we've seen a real uptake in councils and public sector bodies working with voluntary sector organisations to deliver projects and services. So an example of that is one of our London Borough clients who have worked with a bunch of voluntary organisations within their borough to establish food hubs to provide food to those that are extremely vulnerable, clinically vulnerable perhaps. So that's all about sort of understanding the needs within the borough. So down to things like dietary requirements, regionally where they're needed, but also then operationally setting up hubs and being able to deliver the food as and when required. So I think the partnership working has definitely increased, and I think there's some real benefit with that in terms of different viewpoints and different models of service delivery potentially as well. So I think those two areas have definitely been keen. So I imagine that some of that will, whenever we get back to normal and whatever normal might look like, it might then start having an impact.
Yeah, absolutely. And I think that ties in quite well to sort of Karen's point earlier about sort of looking at different delivery models.
Yeah.
And how we can use different models to deliver sort of set outcomes and things like that. So I think that experience really ties in quite well to that point. Karen, have you got something to say?
Just to give an example, to follow up on what Harpreet said there, we've just had a local authority in the southeast recruit a lawyer for their authority who lives in Newcastle upon Tyne and who will be located in Newcastle upon Tyne to carry out their new duties for the South East Council. So it's really extraordinary. I mean, it's really early days, and Harpreet, you're absolutely right. I think the way people have used technology is potentially really revolutionary for them. I think it's going to be really interesting to see how that continues and whether the effectiveness is maintained over time. And just a little bit, you might see me waving my hands in a minute because there's a wasp in the bloody office, so apologies if that does happen.
No, thanks, Karen. I think there's been a few questions on chat, so if I just go through those briefly, bear with me as I kind of. So we've touched upon sort of the question, hopefully from Croydon, around sort of the workers in terms of generalist roles being market's quite saturated. How do you feel, Ian? What's your experience in terms of niche skill sets, in terms of hard to fill? Are you still seeing that there's still bandwidth available in the market? Is there still stuff that's people available, and obviously not just for Ian, for Vanessa and Natalie as well, sort of in terms of what's your experience of sort of those niche, sort of harder to fill roles? Are you still able to find those people? Ian first.
I think I don't really see where we've had sort of any gaps really. Like I say, CV numbers have been really good. Also as well, video interviews have helped. Just the guys facilitating those really. So obviously, they're always difficult and hard to fill. Are always sort of hard to identify good people. But I don't think we've had any sort of individual issues trying to find those people at all. Like I say, I think the agencies have done a good job with being resourceful from home, and like I say, video interviewing to help with that as well.
Excellent. Vanessa, Natalie, has your experience sort of echoed that? Is there anything? Have you looked at different ways in which you've sourced high demand workers in terms of any hard to fill roles, other than what we've already spoke about, I guess?
No, I'd echo what Ian says. We've been able still to fill ours. Our biggest challenge is trying to work out how we're going to induct those members of staff moving forward, and trying to do that remotely. But no, we've not seen any issues with trying to get those roles filled.
Thanks, Natalie. Vanessa?
No, we've not experienced any issues really. I think to be perfectly honest, we are still recruiting as an organisation. Tomorrow and Friday, I'm actually doing Skype interviews, so it's a bit weird interviewing people and recruiting people and never meeting them. So that's kind of a first. But in terms of any niche roles, I think we've just been so focused on our older people's residential, if I'm perfectly honest. The staff that we've got are doing over and above, I think, in terms of what they would usually do to try and support citizens in the organisation. So at the future, in the next kind of like couple of months, we might start looking at the business need going forward. But at the moment, I think everybody's just doing over and above to get through it.
Perfect. And I guess that answers the question from Espo. Espo had a question about, I guess, directing more towards Ian, potentially towards Harpreet in terms of from a not necessarily so from an agency perspective, but from a supplier perspective. But have we had to recruit new agencies to support any shortages? I guess by the sounds of everyone's experience that we've kind of managed to get through. Ian, have we had to go out and get any more new agencies on board? And if so, which job categories have we struggled with?
Yeah, we have. And I mean, I'd say it's predominantly been around unqualified social care. you can find that some clients use or have used historically the same few agencies, but as the needs become greater, that we've had to go out to find more agencies to help satisfy the numbers that we're getting. So yeah, we've supplier engagement have been busy just bringing on new agencies, but we're aware of the agencies who can fulfil the roles. So it's been quite a smooth transition bringing those in.
Yeah, and I know you and I worked quite closely on a project down in the southwest with Nightingale when we were looking at setting up one of the Nightingale hospitals. We worked quite closely to try and in a bit of a panic frenzy, didn't we, for a couple of weeks, because we took a bit of personal responsibility that we've been asked to help and support that project that we kind of took upon it. But so I guess we had to delve our toes into sort of other sectors that maybe we hadn't necessarily got too involved with previously. So so I guess it's that experience. But
yeah, and I think with that as well, I mean the agencies were also receptive to the fact that ultimately we didn't want that business to come to fruition.
Yeah.
But I think they were there to fully support it, and we could have backed it up with the numbers that were being asked us to fulfil. So it all in all, it was a good piece of work all around.
Yeah, no, definitely. I think our managing director at the time, sort of when we sort of spoke to him about the project, there was potential about 700 additional workers needed in Bristol area, and from the get-go, his response to us was, let's hope we never have to fill any of those. And you know, generally meant it, and actually was almost delighted that it never came about, that the work never came about. So we were ready to go, and we had that bandwidth there to support. But yeah, it was a case of it. We'll be there to support, but it's not a nice situation to have to support upon. So, Harpreet, from your perspectives, have you had to go out and recruit any new suppliers to deliver any sort of these sort of outcomes or based professional services?
Yeah, we've been doing lots of supplier engagement, and I think the real positives is lots of suppliers want to help, and they've been actively contacting us to give ideas in terms of how they can support our clients too, which has been really fantastic. When we first started seeing the COVID-19 impacts, some of our clients did contact us to put in place almost like outcome-based resilience contracts. So, for example, within hostel cleaning services, one of our clients contacted to advise that there might be a huge requirement of support needed across a bunch of different hostels, due to obviously needing to clean more and the requirements around that. So they might have needed individuals, but they might have needed more of a managed service provider route where one supplier manages all of the cleaning activity, and then they're paid on outputs, i.e. hostels cleaned or whatever other deep cleaning activity it might be. So we did lots of engagement around that, and we got lots of real good positive response. So again, we've not needed to engage those suppliers, but it's good to have them engaged and onboarded if the requirement does come up sometime in the future as well.
Excellent, thanks Harpreet. I think we're almost out of time. We're coming close to an end. I think there's one more question, I guess for sort of Karen, Vanessa, Natalie. What would you say has been the key lessons that have been learned, and what can you take forward into the new normal?
So it's a simple one. Know your workforce at all times. So understanding where they are right now in terms of their well-being and needs moving forward, I think is absolutely critical. But this sort of notion of understanding what new capabilities and capacity there is in your existing organisation and how you might think about using that differently moving forward, I think is the key early lesson for me.
Thanks, Karen. Natalie?
Yeah, I totally echo what Karen said there. I mean, for us, it's been knowing what other skills people have got to be able to call upon those skills if needed. And again, knowing your workforce, knowing what they're capable of, knowing what health concerns they've got, what health issues they've got, and what they can and can't support.
Thank you. And Vanessa?
Yeah, similar to Karen and Natalie really, but I think whilst knowing your workforce and knowing what skills they've got, we're not I suppose in Lancashire, we're not going to lose those skills either. So, for example, I've had a group of people trained up to be what we're calling super users on agency at the moment, to actually use the matrix system to procure workers. If ever this happens again and we deploy people again, it will be those same people who are deployed back onto matrix. So we're not starting from the beginning. They've already got those skills. So I'm keen not to lose them.
Excellent. Thanks for that. I really appreciate that. I really appreciate everyone's time who's been on the panel today. That's been very interesting. Hope you guys have put up with my poor attempts of being David Dimbleby or whatever his name is on Question Time. But yeah, no, thanks ever so much for everyone's time to be on the panel today, and hopefully everyone who's been on the call listening has found it useful. And obviously keep an eye on our sort of social media channels and whatnot for sort of related blogs and content as off the back of this. But I think it's been very, very interesting. So thanks again, Vanessa.
Yeah, it was just I found this really useful. Natalie and Karen have had really useful things to say. I don't know whether you're planning to do this type of thing again, but this certain kind of interaction with your kind of customers, as I am a customer, has been really useful to kind of learn. We all seem to be doing the same thing, but if anybody's doing anything differently, I'd still like to keep linked in with you guys to help Lancashire through a next stage if we ever get to that. So if you're thinking of doing something again, Chris, then certainly I'm up for being on board.
Absolutely, we'll definitely I'll keep you on our list. I think we're as we are in this new normal where we're unable to really get face to face and have sort of meetings and events. We've always tried to do events like this, but sort of face to face. But where we're in this new normal where it's all virtual, I think we definitely will be trying to do this on a more regular basis. So absolutely, we'll keep you abreast of anything that comes up, and we'll invite you along. Karen, I'm sure you're going to say the same.
Yeah, I am. I mean, Matrix are a platinum sponsor of PPMA anyway, so the guys are always absolutely brilliant. And I think, Chris, you're going to do another one. I think Lutham's been talking to you about that. But Vanessa, in the meantime, just feel free to go on the website, because we've been putting case studies straight on there. We've put that in front of the members zone. So there's some really interesting good practice around there on a number of things. Some of it we have kept privately because, we're talking about pay and terms and conditions and all of the rest of it. But the open stuff, and all of the membership community have been really happy to share that. So please feel free to weigh in, because I do think this format's really helpful, because there's a lot of commonality across the piece, but there's also some really unique differences, and that sometimes is the stuff we really need to get shared quickly.
Excellent. Well, thanks ever so much, guys, and I hope you enjoy the rest of your afternoon. It all looks a bit overcast outside for me at the moment. It doesn't look quite as glorious as when the call started, but hopefully everyone has an enjoyable rest of the day, the rest of the week. But thanks again.
Thanks,
Thank
Chris.
you.
Thanks, everyone.
Thanks a lot, guys.
Thanks very much.
Yeah.
Thanks, Chris.
Bye.